look, it's underlined, right there. Hurthle,
Thyroid might
Hurthle cells, carcinoma.
right nodule. Yeah, what nodule is that? Right nodule. Someone who
Malignant.
diagnosed it here. And it's malignant.
Is it state there?
Here.
Does it state if it's metastasized, or what, how much does that biopsy
Yes, they
report?
could not deny definite result to the right line expression. This expression pattern may specifically strong presence of Hurthle cells and is observed in less than 3 of 9 in Hurthle cells. Hurthle.
Hurthle. It's almost unknown.
Less than 2% of any sample. What did he tell you?
She, Dr. Mirza,
Dr. Mirza is a she, I'm sorry.
she told me very little. It was very cut and dry. She explained the difficulty in diagnosing this through pathology, that it had to be sent to multiple pathologists because this cancer is so rare. So the final reading, I believe, came out of Maryland, I'm not sure where, and determined that it's malignant for Hurthle cell. She did tell me it's a very, very rare cancer.
Very rare type of thyroid cancer.
Right.
The other type is definitely more.
She didn't state if it's metastasized. She stated very little. She said, go see your primary. Of course, you can imagine, I'm in pieces. I'm distraught. I can't make sense of this. 23 hospital stays, and it took me to be diagnosed with a rare cancer. But all this time, they've been telling me it's acid reflux and GERD and in my head, you know. And now I'm probably gonna friggin' die because.
Well, don't exaggerate. I don't think Dr. Mirza tell you all of this. I don't think Dr. Mirza told you that because it's.
She said it's non-treatable. Non-treatable. She said it's does not respond to chemotherapy or radiation. It does not respond.
Number one.
She told me it is.
You're
not
going for
treatable.
surgery. That's mean you need surgery. If they remove all of it and it doesn't metastasize, so okay. When you have cancer, right?
Mm-hmm.
First of all, nobody knows if it's true. When they remove the thyroid, then they will know for sure. Listen. Maybe that little fine needle cannot give them too much. When they remove the thyroid, this is when you're going to have the real pathology. If I were you, I would not go crazy that you're going to die of something. Okay?
Well, my teeth, doctor, in the last 2 months have all started crumbling. She said that's saliva glands or something.
Mm-hmm.
I've been getting this horrible pain in my esophagus. I was in the hospital last week.
You're in the hospital for what they say it is.
They wanted to take my gallbladder out.
Why didn't let them?
I did not let them because I was scheduled for a biopsy the next day, and I've been waiting 3 months to get this done. So I asked to hold off on the gallbladder removal.
Then I send you to see the same surgeon can do the gallbladder for you.
That's what I'm thinking, to get it all done at once and check the esophagus.
But if you're having a lot of pain, you can go back to the emergency room for it. Okay?
I'd rather just do one surgery if possible.
What did I know? You have gallstones?
Gallstones, yes.
Where's the paper? Because before I can ask for
JFK was supposed to send that to you. I went and signed a release.
Okay.
JFK has that. The hospital has all those
Good
records.
gas on result. There is no. Please schedule the patient to come into the skeletons and result there. They are recommended 5 needle of nodule.
My GI visit's not for another 10 days. It's taken that long to get an appointment. But JFK did do every imaging possible on me. JFK told me it needed to come out. 2 weeks ago I was admitted. Or a week ago, last week.
What I'm trying to say is, before I can put the referral, I have to have something to go by. I have to have some documentation. I cannot say the patient told me if she was supposed to remove gallbladder and surgical consult.
Oh, okay, I thought,
You understand what I'm saying?
yes, I was admitted at...
Like you bring this, if you tell me they told me that, they didn't give you this, they told me that they are going to send you the record and I have a bad rare case of cancer, I need surgery, I have to have a documentation.
I understand.
This one I have a documentation.
When I saw you like 3 months ago, I think I signed a letter with you to get my records from both hospitals.
This is the thing.
They did imaging on the gallbladder.
Let me go this way.
The gallbladder was detected a few months ago.
Let me see if you tell me here. This was 2016. The only record I have for GFK is 2016.
Yes, and that's, I saw you just before the first of the year. Do you have the gallbladder report there?
So when was the gallbladder problem?
It's been,
Yeah, I have it in my.
It's been ongoing.
I have it. I'll send you to see it. I have it. It was there. Calculus of gallbladder without cholecystitis.
and then the esophagus has been a problem as well. I can't eat. I vomit when I eat. And I think you told me, doctor, that I have Barrett's, or Dr. Stewart maybe. Someone told me I had Barrett's disease, or maybe Dr. Mirza. Dr. Mirza told me I have an inflammation of the esophagus.
Inflammation of the esophagus can be caused by acid reflux.
Yes.
But for someone to say Barrett's esophagus, you have to have an EGD.
Okay.
Did you have an EGD?
No. She said that I did.
Acid reflux can at the long time can give Barrett's. It doesn't have to give Barrett's. Me, I have acid reflux for the longest time. But by God grace, I don't have Barrett's. That doesn't mean you're going to have Barrett's automatically.
She told me, doctor, that JFK did do one of those tests on me.
EGD, that's made you
Yes.
sleep and pass it through down your throat?
I don't recall them doing it, but Dr. Mirza said that she got my records.
I'll get Dr. Mirza also that document when I'll check Dr. Mirza. In the meantime, I'm giving you the surgical consult for your gallbladder and for this. This one is the most important.
Yes, it is.
Okay. The blood pressure is a bit elevated today.
Oh yes, it's been high. The medication's not helping.
It's not enough. No. You are on lisinopril, amlodipine, now you're taking and metoprolol. You're taking all three for your blood pressure?
Whatever you had prescribed to me last visit, I'm taking as prescribed.
Do you bring your medication with you?
No, I did not, doctor.
I need to know which one to increase. Because you are on metoprolol, a low dose daily. You are on lisinopril, a low dose daily. And you are on amlodipine. When I first see you, I just refilled them.
We decreased
but the blood pressure has been controlled. On January 6, 2017, your blood pressure was good. On December 2016, your blood pressure was good. Now I think probably you're under stress. But they are supposed to repeat the blood pressure.
And now my heart rate has been running low.
Yeah, you are. Oh, we'll just stop we'll just decrease the metoprolol. Here your heart rate is not low, 82.
Dr. Mirza also she was going to contact you, wanted to change something with my medication. I don't recall what medication it was, but...
For what reason you want to change something?
She thought it was too much of something. I couldn't understand her accent very well.
She should send me her records. So far, let me see.
I gave her your information. She said she would send everything to you.
When did you see Dr. Mirza?
Friday.
He hasn't seen it yet. The blood pressure was usually good. It's because you're under stress. I will check it myself. You are taking 3 blood pressure medication. I wanted to make sure you're taking all 3.
I can't ingest any food without vomiting. It's been that way.
The gallbladder need to be out. Are you still smoking?
I've cut way back. Yes,
Good for you.
I'm about 5 cigarettes per day.
Good for you. Because if really you have Barrett's esophagus, you should not smoke. So you went to JFK, when was it again?
I was at JFK 10 days ago.
Mm-hmm.
I believe I was there for 3 nights.
For what reason?
I went in due to, I passed out, I blacked out, and uncontrollable vomiting. They kept me because my heart rate was around 43.
What did they do?
They gave me IV fluids and potassium. They said I was dehydrated. They administered IV potassium and IV fluids. Said my kidney function was elevated.
No, dehydrated. You
And
passed out completely?
completely. Paramedics came and picked me up. Somebody called the paramedics. I'm sorry?
We have to send to JFK to get the record.
Since I saw you last, I think I've been admitted 3 to 4 times at JFK. All pretty much the same reason. Some was chest pain.
Did they check your chest for your heart?
Yes, they
What did they say?
they thought esophagus. But they did do, I went into the cath lab. I think it was December, I had the cath. They said to follow up with my primary. They kept me, got me stabilized. They did a few imaging tests. It definitely showed the gallbladder and then some kind of inflammation of
Well, you are
the,
going to remove it, you could not, I'm understanding.
and they said inflammation of the esophagus. So they said, go follow up with your primary.
What?
Then you pull a leukemia, there is going emergency phone call. You have to do it to reschedule the fixing. Okay?
Mm-hmm.
Dr. Mirza also sent me to Quest with
Moi, je vous sais que moi, madame Talon, vous dites, pas de problème pour la, non?
Il va dépendre de quoi tu m'as créé.
Did you get copies of my labs from Quest within the last month?
I check. I cannot do everywhere at once. I'm trying to put the reason you come here, then we'll do it. Okay?